Hi, this is Alicia. My project is titled Mental Health Education in Schools is Vital to Ensure that Children are Given an Equal Opportunity to Get an Education. Hi, this is Why Mental Health Awareness in School. An increasing amount of evidence has found an association between adverse childhood experiences, such as trauma, violence, or abuse, and a child's ability to perform in school. Students spend a large portion of their time at school. Teachers and other staff interact with students on a daily basis and are in the prime position to recognize the signs of emotional or behavioral distress and make appropriate referrals. The current safety programs that school districts employ tend to put more emphasis on natural disasters and external threats and less on how to recognize and respond to potential mental health crises. State legislatures recognize that Washington's youth have a higher than the national average risk for suicide. In July of 2013, Congress amended the engrossed substitute House Bill 1336 to add additional suicide support and prevention training. The engrossed substitute House Bill 1336, an act relating to increasing the capacity of school districts to recognize and respond to troubled youth. Current coverages. Under the engrossed substitute House Bill, individuals certified by the Professional Educators Standards Board, such as a school nurse, school social worker, school psychologist, or school counselor, must complete a training program on youth suicide screening and referral as a condition of certification. Professional educators are required to take a minimum of 3 hours of suicide prevention training every 5 years. Each school district must form a plan to help school staff recognize, screen, and to respond to emotional and behavioral issues that signal a possible sign of substance abuse, violence, and youth suicide. Learn the proper procedures for communicating with parents, dealing with crises, recognizing the signs, and assisting children who are being harassed, intimidated, or bullied. Is there a problem? Suicide is the second leading cause of death for Washington's youth between the ages of 10 and 24. Suicide rates among Washington's youth remain higher than that of the national average. Among young people aged 10 to 14 years old, suicide rates have doubled in the last 2 decades. Ignored symptoms of emotional distress in adolescents and adults is the leading cause of absenteeism. Is there a problem? Homicide is the third leading cause of death among young people aged 10 to 24 years old. It's responsible for more deaths in this age group than the next 7 leading causes of death combined. Between 50% and 75% of youth in juvenile justice facilities suffer from an undiagnosable mental health disorder and frequently do not receive counseling or treatment or support. The legislature finds that a lack of information about mental health problems among the general public leads to stigmatizing attitudes and prevents people from seeking help early and seeking the best sort of help. It also prevents people from providing support to family members, friends, and colleagues because they might not know what to do. This lack of knowledge about mental health problems limits the initial accessibility of evidence-based treatment and leads to a lack of support for people with a mental disorder from family, friends, and other members of the community. Washington State school districts need to put the safety and well-being of students as the #1 priority by investing in mental health programs for teachers, students, and community members. Potential policy program. The 3 levels of mental health education and awareness. Primary prevention. To prevent children from developing severe mental health problems and to promote healthy development. Depending on the staff-to-student ratio, there are 2 options. Teachers or staff that are qualified to identify signs of emotional distress in children must briefly meet individually with each student on a weekly basis and simply ask them how they are feeling, what they feel positive about, if there are any areas in their life they are struggling in, and how they can help them. Or, every week for 15 minutes, have students break up into groups, about 4 or 5 students each, alternating the children each week into new groups. Have them ask each other the very same questions that I addressed previously. These practices will help to lift the stigma that only sissies talk of other feelings and help open the lines of communication. There may be staffing issues associated with the first option because resources are scarce, but the second option allows school districts to implement a class-based discussion on mental health issues with the resources they already have. The second level of mental health education and awareness. Targeting populations that have a high risk for developing behavior or emotional problems before they have developed. Some communities have a higher risk than average for developing emotional or behavioral issues. Adolescents tend to follow the footsteps of others. They develop attitudes by observing those around them. Abuse, poverty, divorce, crime, violence, single parents, and mental health issues are more prominent in some groups or areas than others. Without early interventions, the onset of developing psychological dysfunctions is extremely likely for adolescents who are continually exposed to chaos. There is empirical evidence that supports targeting groups of at-risk youth does decrease the onset of a severe mental health issue. School nurses and psychologists must refer students and their parents to services that are offered in the community or information on resources they can get the help that they need. The third level of mental health education and awareness in schools. Targeting individuals instead of groups who will be or are experiencing trauma, such as a divorce, entering a new school, dealing with the sickness of a loved one, and any other transition a child may be going through. School staff must be more involved in students' lives. There is usually recognizable signs of emotional distress, including a lack of interest in activities that a student was previously interested in, withdrawing or isolating themselves from others, failing in school, getting into trouble, fighting, any other signs of physical or emotional distress, skipping school, lying. There are many other signs of emotional distress that can be easily recognized. The signs may even be apparent before a child realizes something is wrong. This is why it's important to catch and deal with emotional issues before the effects are irreversible. Staff must pay attention to any changes in a student's attitude or abnormal actions and relay it to a school psychologist and provide referrals when necessary. Policy. Statewide mandate for all public schools to provide mental health education in the classroom and through the use of a program such as the one outlined by the UCLA psychology professor Howard Adelman, where students receive mental health education as part of their curriculum. I do realize that Washington State is probably a lot larger than what I can start out with, so my policy is actually more directed towards Ferndale School District, which is in Washington State. Reasoning. Communities who prioritize prevention programs have a lower rate of youth violence compared to those who focus mainly on providing support in the wake of a tragedy. Mental disorders are chronic, and without early detection, they can last a lifetime. Children with mental disorders tend to have more problems at home, in school, and forming friendships. Half of all lifetime cases of mental or substance use disorders begin by age 14 and 3/4 by age 24. Mental health affects the overall health of an individual. Individuals with mental illnesses are 4 times more likely to die from a treatable illness than other individuals, and 58 times more likely to die before the age of 50. Funding. Mental health disorders cost the U.S. an estimated annual total of $247 billion. Between 13 and 20% of children living in the United States experience a mental disorder in a given year, and surveillance from 1994 to 2011 has shown the numbers are increasing. The National Alliance on Mental Illness provides a wealth of free information for educators, students, and community members. There are free slides for teachers to use to help guide lessons on mental health, pamphlets, and handouts that help recognize the signs of distress, including information on suicide prevention, suicide hotlines, and resources. Washington State's 0.1% county referendum, which is used to fund mental health initiatives, is a likely avenue for pursuing funding. I will also try to pursue funding through the use of a levy on business and property taxes in Ferndale, Washington, to fund any additional costs that may be incurred from my mental health awareness, prevention, and intervention policy, as well as applying for the Safe Schools, Healthy Schools program, which provides grants up to $1 million each for on-site licensed mental health professionals in schools. I have also contacted Anacortes Washington School District to find out how much it costs them to implement the Safe Schools program. However, I have not been able to obtain any figures from them. This is why I decided to start small, just by making little changes to how Ferndale School District deals with mental health issues. And I decided to focus on releasing the stigma on mental health. Although we associate changes in curriculums with large sums of money, That is not necessarily true. The state of Alabama adapted an integrated system similar to a mental health policy that a successful school in Gainesville, Georgia, Alabama, whose program deployed existing resources rather than adding new ones. All of the resources they used were provided for free from the mental health in schools at UCLA. In conclusion, Ferndale School District would need to pass a district-wide bill with the help of NAMI and MHA. Mandating mental health education will help to educate thousands of individuals and lead to more productive, healthy, and happy environment that everyone deserves. Education will reduce the stigma and more people will seek help. There is a low-cost solution to a high-cost issue. Continuing to place judgment on others for emotional or behavioral disturbances may be alienating or blaming the victim and contributing to the problem or creating a new one that contributes to policies and practices that are not making significant progress. I provided evidence from reputable sources that prove changing behaviors after they have already established is harder than developing healthy behaviors from a young age.